palpating the hip, you're looking for obvious deformity, crepiness, pain or point tenderness, temperature changes, and swelling. So when you're palpating someone's hip, it's always important to ask permission. So, is it okay if I touch your hip?
Yes.
Okay, so to start, you have the ASIS, and then just inferior to that, you have the AIIS. You can have them take their hand, palpate their pubis. Then you have the iliac crest. On the lateral side of the leg, you have the greater trochanter, and then you have the lip. And it's important to also ask that you can touch their glutes. Is it okay if I touch their glutes? Then you have the PSIS, you have the sacrum and the coccyx, and then the ischial tuberosity. Then moving on to muscles. In the posterior aspect, you have the glute med, and then just lateral to that, you have the, you have the glute max. And then lateral to that, you have the glute med. Posteriorly, you have the hamstrings, and then medially, you have the hip adductors. On the lateral aspect, you have the tensor fasciae lata. Then I'm going to have you flip back over. In the front, you have the sartorius, which comes from the ASIS and comes down and attaches to that Pezanserine group. It comes down and attaches to the Pezanserine group. Then you have the iliopsoas, which goes from T12 through L4. And then attaches to the western tubercle of the femur. And then you have your rec fin. Then to do manual muscle tests for those same muscles, you grade it on a scale from 0 to 5. 5 being they're able to do it against full resistance against gravity. Grade 4, they're able to do it against mild resistance against gravity. Grade 3, it's no resistance against gravity. Grade 2 is the movement with gravity. Grade 1, they have contracture, but no movement. And then grade 0, there's no contracture. So to start, I'm going to have you come sit to the table. So to manual muscle test, rec fin, you're going to support just above the patella. You're going to grab just at the ankle, and she's going to extend it out. A concentric, and then we're going to do iliopsoas. So you're going to support them so that they sit nice and tall. You're going to resist right at the superior to the knee. She's going to lift her leg up, again for concentric. Then we're going to do sartorius. So she's going to try and bring her foot up towards her opposite knee. You're going to support and resist with your left hand right at the knee, and then resist at the ankle with your hands. Up, again for that concentric. Then in order to test the hamstrings at the hip, we're going to have her legs stay straight. She's going to lift her leg as high as she can, and don't let it push you down. You're going to support at their low back so they don't try and cheat. Once to test the hamstrings at the knee, you would have them bend their knee, and then don't move out. To test semimembranosus and tendinosus, you would turn their foot in, and then if you externally rotate them, you're going to be testing biceps femoris. And again, just that block. In order to test glute max, you're going to again support them right above the hip. She's going to push her leg up into my hand. Then you're going to turn her to your side. So in order to test her glute med on her right side, she would lay on her left side. Again, you're going to support right at that hip, bring your leg up, and don't let me push you down. Then bring your foot in front. So to test her left hip adductors, you're going to bring your right foot in front, again support at the hip, bring your leg up, don't let me push you down. Then we're going to do lay on the back. The last one is the test the tensor fascia. So she's going to come into hip abduction. And she's going to hold here and don't let me push you back. Don't let me push you. You're going to hold it here. Don't let me push you. Okay. Then we're going to do special tests. So to start, we're going to do the anterior impingement test. So you're going to have them come up into knee or hip flexion and knee flexion, and you're going to internally rotate. Positive sign for this is pain, and that implies there is an impingement in the hip. Then you're going to do hip scoring. So it's a little bit easier if you have a stool. You're going to apply an axial load, and then internally and externally load the hip. A positive sign for this is pain and then clicking or a popping sensation, and that implies a hip labral tear. Then I'm going to have you land that's your right side, come to the edge of the table. Then we have Over's test. So have them try and relax to the best of their abilities. You're going to bring them into knee flexion and hip extension. Have them support themselves by holding the other side of the table. Then you're going to slowly extend their knee. And then, Morgan's a perfect example. You kind of just let their leg fall as best in their ability. And Morgan has a very tight IT band or tensor fascia lata, so she doesn't drop below midline, which is a positive test. It implies that tightness. Then we're going to do Eli's test. So she's going to let me bring her foot towards her butt, and what you're looking for is their hip on this side to kind of roll up off the table. This implies a tight iliopsoas, and there'll be pain, and then they also roll. Then you have the femoral nerve traction test. So again, you're going to bring them into knee flexion, and then you're going to bring their knee up off the table, so it's a hip extension. A positive sign for this is increased burning, tingling, or numbness that travels down your leg, and this implies a femoral nerve impingement or some femoral nerve pathology. Then you're going to come to the edge of the table. We're going to do Thomas test. So what you're going to do is you're going to sit right on the edge, grab one knee, and just lay back. And what we're looking for is their upper leg or quad and hamstring to be up off the table, and if it is, that implies iliopsoas tightness. If, like her leg shows, they can't keep a 90-degree bend with their leg relaxed, and they're puking out, this is a positive test and it implies rec fem tightness, and then you have to switch to the other side, just to compare bilaterally. So as you can see, she gave a positive sign for rec fem tightness, maybe a little bit for iliopsoas. Then come on up, and if it's that way, yeah, sure. Then this is Trendelenburg sign, so you're going to ask if you can palpate and find their PSIS. So you find their PSIS, and then what you're going to do is have them stand on one leg. And what you're looking for, is that the leg that she's standing on, that hip drops, and that's a positive sign. And if that hip drops, it implies the opposite glute med is weak. So in her case, if she were to drop when lifting her right foot, she would have weak left glute med. Then we're going to do range of motion. So, to start, we're going to do hip flexion. So you're going to ask if you can palpate and bend your knee. Because the greater trochanter moves, it's easy to have them in a relaxed position and then find it so that you know where your axis is. Your stationary arm is going to be lined up parallel to the table. When you're ready, have them pull their knee as far to their chest as they can, lining up with the lateral condyle of the femur, but relax. And then you're going to read off that number. We're going to have 133 degrees of hip flexion. Then to do hip extension, again, you want to line up the axis with her greater trochanter. Stationary arm is in line with the table or parallel with the table. Then what you're going to do is you're going to have them keep their leg nice and straight and try to lift up off the table as best they can. Go relax. You want to make sure that when they're doing this, that you can kind of support their low back if you have enough hands or an extra person to help you, or just make sure that you have them try it once and they don't go past the point where they feel like they're lifting that hip off the table. So we're going to do one more time. Sorry. So then rest. So Morgan has about 22 degrees of hip extension. Go ahead and lay back on your back. Then we're going to do, actually come to the edge of the table. Hip internal and external rotation. So this is a little backwards because you're actually going to have their foot go the opposite way that you're trying to measure. You're going to put the axis midway on the patella. You want to keep the stationary arm perpendicular to the ground. And then your stationary arm is going to line up with the tibial tuberosity, which is helpful if you can mark it before you do this. So in order to do hip internal rotation, she's going to bring her foot out. And she's going to rest. Then you're going to read that number. So she has about 30 degrees of internal rotation. And then reline it up. You can try and get that other foot out of the way. So bring your foot in. Okay, 41 degrees of external rotation. Alright, then she's going to lay back and we're going to do hip abduction and adduction. So you're going to find their ASIS. You're going to line up the leg that you're measuring. You're going to line up the axis with that ASIS, and then your stationary arm lines up with the opposite. Have them hold that for you. And then your movement arm is going to be lined up with your midway patella and your tibial tuberosity. So go ahead and bring your leg out as far as you can without rotating. And then collapse. Then you're going to read that number, which for Morgan will be 47. Then she's going to slide to the other end of the table so she can kind of kick that foot off. Again, you're going to line up with the ASIS on both sides. Then you're going to bring your foot and leg across your body as you can before you rotate, or your hips totally go misaligned. She has about 12 degrees. Then, last thing we're going to do is leg length. So you want to use a tape measure that has centimeters. So you're going to start from the ASIS, line it up with the 0 mark, have her hold that. And what you're going to do is you're going to come down, and you just have to pick where on the medial malleolus you want to line it up with. Some people do it from the top, middle, bottom. I'm going to do it with the bottom. So you want to make sure that they hold tight and then you pull tight. So Morgan has about 89 centimeters on her right leg. And then you're going to line it up. So find the ASIS on the other side. Have her hold it. She can find it. You want to make sure your tape measures nice and tight. And so on her left side, she is at she's at 90. So she is within functional limits because with leg length discrepancy, you're looking for anything that's greater than 1 centimeter difference, which can imply or which can create like gait abnormalities. And it's something to look for to make sure that you have proper muscle balance. And that's all.